This one's the Community Reablement and Home Care Services for Adults in Hammersmith and Fulham. Not every tender is ideal for your business. Market engagement events help you to influence the council and Fulham. So we're going to cover this tender in its entirety so you understand exactly what the requirements are, if you should bid or not bid, and what your likelihood of winning the bid is should you decide to bid. For those who don't know me, my name is Divine, the founder of A Short Bid. We exist to help agencies to find the relevant contracts and win the contracts as well. Now, this tender has been split into two lots. The lots essentially make up the list of services, activities, the support you as an agency will need to provide for the individuals within this framework. For example, in lot 1, this is specifically for the provision of community reablement. For those who are not familiar with reablement, this essentially is a short-term intensive support you would need to provide for individuals who may have just been discharged from hospital after a long-term period of recovering from a particular illness or condition within a hospital. So in that period of time, it's quite common for individuals to have lost some mobility physically, lost the ability to perform certain skills or tasks, potentially even lost some confidence mentally. So this support isn't just a standard home care support, it's intensive short-term support geared to help them recover or regain those lost skills, for example. Then lot 2 is a focus on domiciliary care, so home care services, which again, in a nutshell, you're helping individuals, in this case, this will be adults from 18 to 64, to live a more independent life. So helping them with particular daily life skills, daily tasks, medication, personal care. Now, before you decide to bid for this tender, if you can deliver reablement or home care, like I said, it's split into two lots. Lot 1 is ideal if you have history, experience, resources, and capability to provide reablement. And lot 2 is for the agencies that can provide domiciliary care / home care services. If you can provide both, you can bid for both. If you want to provide just the one or the other, bid for the one that you are most strongest and most confident in. However, please understand the other or some of the key criteria you need to make sure you tick first. Number 1, you need to have a CQC registration. So your agency needs to be CQC registered. Secondly, your agency needs to have been inspected by CQC and have a rating of at least good. So it should be good or outstanding with CQC. Thirdly, it's very common for tenders and frameworks like this have a requirement for your agency to have a registered office, so a CQC registered office within the borough. This isn't a satellite office or just any physical office. It needs to be an office that is also registered with CQC. But most importantly, this office needs to be within Hammersmith and Fulham. However, in this case, you can also demonstrate, or you would need to show a mobilization plan. So if you're not currently based in, your office isn't currently in Hammersmith and Fulham, however, you're an experienced provider, you can deliver the services, you tick all the other boxes, you will simply need to demonstrate and show a mobilization plan on how you intend, or showing your plan of mobilizing office, resources, staff, etc. within this area, at least 6 months of getting awarded the contract. So again, this is quite useful for agencies because this might prevent you from having to, pay for an office, which is quite expensive, just to bid for the tender. And potentially, if you fail that bid, you're already locked into maybe a long-term lease in office, you've lost a lot of money. So in this case, you don't necessarily need to do that. You just need to demonstrate your mobilization plan within your bid. Now, in terms of cost, obviously, you do not need to provide the accommodation because the services you're going to be delivering will be within the individual's homes. So this is going to be very dependent on you having a good local knowledge. You need to be able to demonstrate that you have relevant contract examples where you've delivered similar services in the past. So this is the technical ability requirement here. This is very key because if you are going to be delivering these types of services, you need to demonstrate to the borough here that as an agency, not necessarily as an individual or the director or the registered manager, but as an agency, you have or you are continuously working with XYZ individuals who have these conditions and need to have these support needs, and you're providing these support needs to a very high standard, because you will need to demonstrate and also give referees that will verify what you've said in your bid as well. So again, the technical capability requirement is very important, because if you're a new agency, maybe you've got a rating, you've got the office, you've got your CQC registration, but you've only got maybe one private client. Should you be bidding? Even if you should be bidding, really think about how you're going to demonstrate your experience to a very high standard, convincingly, and give the borough the confidence that you understand, you know what you're doing and how to deliver these services. Now, another area that you need to also consider is how many suppliers is the borough looking for on this framework? So how many suppliers are they looking to approve to join this framework? This is a strategic decision, not necessarily a compliance requirements, etc. This is more of a business strategic decision if you should bid, especially if it's costing from funds to pay for the completion of the bid or time or resources anyway. First of all, understand what the likelihood is, and to understand the likelihood is of you winning, one section and a question you need to ask yourself or find out on the tender is how many suppliers are they actually looking for? Now, in this case, they're looking for 9 suppliers across the lots, which means you need to understand, based on the other criteria, how much of these criteria you meet, which you should meet all of it. And also, even if you do meet the criteria, to what standard do you meet that criteria? For example, if you need to provide up to 3 contract examples where you've delivered similar services and you only have 1, some agencies may decide to opt out because potentially they may not have a strong enough bid. But even if you do decide to bid, potentially explore other ways to demonstrate your experience and your capability as well. But again, even if you are bidding, understanding how many suppliers will give you an idea of the likelihood of winning the bid. But also, if you do win, you know at least you're one of a few limited number of suppliers, and you are more likely to get work and referrals from the bid. But again, in saying all this, even after we've covered the regulatory requirements, covered the experience and the background requirements, and also understanding the strategic decision you need to make to bid or not to bid, you still need to go through the files in more detail and do your own due diligence. That's why I've shared the link in the description. You can access bid suites, check what the files say about whatever question you want to understand, but also you can see the rest of the criteria where we haven't covered in this video. That's the policies you need to have, that's the financial requirements, etc. Care agencies in London or looking to expand into London, or you're considering starting one, make sure you're subscribed to the channel and turn the alerts on, because I'm going to be sharing a lot more tender opportunities on a weekly basis that cover domiciliary care, supported living, reablement, even unregulated supports, because there are a number of opportunities that don't require you to have any license or registration with CQC, Ofsted, CIW. And as agency owners, you need to know when these come out.